Hello, everybody. As you're coming on, I just wanted to give you a quick reminder to please go ahead and turn your video off just in case we run into problems with bandwidth and ability to have enough internet capabilities to support this breakout session. And to also please go ahead and mute your microphones. And we'll just give about a half a minute more for the rest of everyone to come aboard. All right, just one more quick reminder to go ahead and please disable video and mute yourselves. And we're so glad to have you all today. Thanks for joining us in the clinical skills preparation breakout. I'm Chris Anderson, and I'm a pediatric clinical educator with the Elson S. Floyd College of Medicine. By training, I'm a pediatric cardiologist, and my colleague Jake Pranuski is joining me with Medical College of Wisconsin. He's the Assistant Dean for Clinical Learning there and also has a Master of Science in Public Health. So we are so grateful to have you here. And one more note about how we'll proceed. We are hoping to have plenty of time for questions at the end, but I'll ask you to please use the chat tool to ask questions, and we'll collate those with our moderator during the session. And at the end, we'll have plenty of time to address questions. So just by way of overview, we will start with some general pieces of advice. We want to provide you with several pearls for how to leverage the capabilities of Aquifer, which for those of you who explored it thoroughly, you know how rich and deep these cases go, and that it's a fantastic platform for developing learning tools that can really go above and beyond this sort of modular approach to learning. And so specific pearls that we'd like to share with you today in how to leverage Aquifer include the use of Aquifer to help students develop their skills in oral presentations and practical skills of how to do a patient handoff or handover to a peer, and also for calling a consult. And we'll suggest some other ways that you can similarly use Aquifer as we go. So just to begin with general advice, one of the things that both Jake and I agreed is a fantastic capability of Aquifer is how rich and deep these modules go, and they really lend themselves well to creating a real world sort of environment. In cases that are more outpatient, it can be very useful to simulate a real clinic environment, or for inpatient modules, creating a sort of rounding environment with your students. And to use the cases as source material, but going well beyond that source material to develop an activity. So you take a case and, for example, the case that Sherry Lynn just shared of a patient with palpitations, and you have an idea for an activity, for example, creating an oral presentation. How do you integrate that Aquifer case into your students' learning. And so you really need an idea for an activity, and you need to know the cases. So as a course director, for those of you who are course directors, you really want to make sure that you've looked through the cases that you want to use for these learning activities well in advance, and to guide your preceptors who are going to help facilitate those cases with the students. And so in an example that we used, we developed a preceptor guide that very clearly outlined what activities we wanted to do. Please do attend to the pedagogy. So as you know, the Aquifer cases have a list of objectives in each case. Okay, sorry about that technical glitch, everybody. Not sure what happened there, but I'll give it a couple more seconds for everybody to come on, and we'll keep charging forward. Thanks for your patience. So attend to the pedagogy when you use Aquifer cases to develop activities that help with clinical skills. In other words, if you have a competency-based education and you have objectives for communication skills, Aquifer is a great way to create activities that allow students to develop their oral presentation skills, which Jake is going to talk about in just a minute. Similarly, consider how are you going to use the learning objectives for your sessions, learning objectives embedded within Aquifer cases to actually evaluate your students. And so without any further ado, we'll move forward with Jake.
Thanks, Chris. As you said, my name is Jake Prusky. I've been using Aquifer for about a decade now, and we baked it into our curriculum as we started our new campus here 4 years ago. So we actually use Aquifer cases in all of our courses, both preclinical and clinical. It's been especially helpful for us with our preclinical students in developing their oral presentation skills, and with our clinical students in whom we identify a need for remediation. Particularly, you've got a student who's got troubles doing this, it's bogging down their office day or their visit day. This becomes a way to create encounters to help that student practice those skills before putting them back into a clinical environment. One of the things we'll do with our early students is have them work through a case. A lot depends on your individual structure and how you approach this. I like to use class time for this and actually give them a half hour to 45 minutes to go through a case in class, either on their own or in small groups, and then immediately turn around and present that case. It creates that real world challenge of having to process the information really quickly and turn it around and present it to an attending. And doing them back to back is very different than if they get to go home, ruminate on it, sleep on it, or write up a note before doing the presentation. So I'll have the students pair off in groups of 3. One student will give the oral presentation. One student will actually act as the attending who's receiving that information. I want them to sort of look at the student who's presenting, nod their head occasionally, and give the presenting student someone to focus on. And then the third student, we actually give an evaluation rubric. And we have the student with the evaluation rubric evaluate the presenting student. This is a double benefit learning opportunity. If you could flip forward one slide. The student who's presenting obviously gets a chance to present. The student who's listening hears the quality of the presentation. But I think in some cases, the most benefit comes from the student who is observing the interaction, and they can focus on the items we have on our rubric in terms of the content of the presentation and the material presented, the physical exam presentation, formulation statements, look at timing and volume and eye contact, sort of verbal and nonverbal communication skills. And then the three students can debrief with each other and share those interactions. We then have them flip, do another case in reverse, and over a morning session, each student gets a chance to present, observe, and be the observer. Next slide, please. There are a number of considerations in doing this. One is just physical space and faculty space. It works perfectly well in the format we're doing here. So you can have a video interaction using BlueJeans or Zoom or WebEx that mimics the situation quite nicely. In faculty as the faculty or residents as the faculty is great. I especially like using residents if that's available, because the residents often need this as much as my students do. It helps alleviate some of the faculty need. We've also looked at having one group do this while other groups observe. So essentially you put someone on a pedestal in front of the classroom. It's feasible, but it's incredibly intimidating. Students don't want to be volunteered to be the one presenting in front of their entire class. But if time is limited, it does create an opportunity for larger group instruction. The other possibility is if you have recurrent didactics, you could have a single group do this each time over multiple weeks or multiple months of a longitudinally integrated clerkship to keep coming back to this skill over time. That's feasible, but sometimes a little bit disruptive because it's a drop-in amidst whatever else is going on during those larger sessions. So I guess I've found this incredibly valuable, particularly helpful with remediating students who are having trouble with oral presentations in their clinical years, and invaluable for our early clinical students to gain experience prior to working with standardized patients or prior to going out to early clinical experiences with physicians. Next slide.
Okay, thanks so much, Jake. So we'll talk about another use for Aquifer, and this is a use that we specifically used in our medical school in year 3 virtual learning with the COVID pandemic disruptions. And we actually found that in surveying our students, they really hadn't had many opportunities as year 3 medical students to develop their skills in patient handovers. And so what we did was we grouped students in a number of small groups, 5 students to a group with 1 pediatric preceptor, and used Aquifer cases to create a rounding-like environment and have developed an activity for students to present their Aquifer patients to their peers as a handover. And so we used the Aquifer cases as the source material. We had both inpatient and outpatient cases. And so it's easy to develop the handover skill for inpatient needs as well as outpatient needs. And as I mentioned earlier, there's already really well-written and granular learning objectives within the Aquifer cases, but what we determined was that we had some sort of higher level objectives with regards to skills and competencies that could be addressed that really were higher order objectives than the granular objectives for the cases. But the preceptors do need to know the cases in advance, as well as the course director who really generates the activity in order to make this session with the students the most effective. And so we developed guides for preceptor facilitation, which included the cases, and had the preceptors study those guides and those cases. And so one example of taking a learning objective for this activity, specifically patient handover, was that we wanted students to present a concise and organized oral or written summary that documents a clinical encounter to members of the team. That's the high level objective in that domain of competence. And the lower order objective was to demonstrate effective, timely, and respectful communication with peers, patients, their families, in this case, peers. And so for those of you who are using competency-based curriculum, this will hopefully resonate with you. There's other curricula that use the entrustable professional activities, and so we also mapped activities directly to EPAs, in this case, EPA number 8 in the 13 core EPAs for entering residencies, which is to give or receive a patient handover. So it matches up very well. And this was the activity to have a student sign out their patient to a peer. We wanted to provide guidance to our preceptors for how much time needed to be allotted for the activity, and to include these elements. Some folks may be familiar with IPASS framework for providing handovers, and you can use that kind of a framework as well. And we wanted to match the assessment up to the skill that we're developing. And so this was our assessment for this specific activity. In our assessment rubric, we have basically a 5-scale assessment that in the lowest area of performance is opportunities for growth, and in the highest area of performance, students exceed expectations, and with varying shades in between. And we provided preceptors with the potential to state that the skill was not observed. And so that was our handover activity. Another Pearl was calling a consult. And so in this activity, students consulted with a specialist that they determined who that specialist would be based upon the case that they were assigned, and had the student call a consult with the preceptor serving as the consultant. You could easily also have fellow students serve as the consultant. And so this activity, again, we allotted 5 minutes for the call. In this small group activity, that's going to take about 25 minutes for a group of 5 students, and with as much time to provide feedback, you've got an hour's worth of activities there. There are other possibilities and considerations for generating activities to develop clinical skills, including you could easily imagine taking Aquifer cases to have a student activity where they obtain informed consent. It could be their fellow student serving as the patient that is giving consent, or it could be a preceptor, whoever. Prescription writing is another activity that we used in our distance learning, virtual learning clerkship. Note writing, we use that as well. Revisiting cases as students progress through the curriculum is another idea that you can come back to. And with Jake's activities in pre-clerkship students developing oral presentation skills, Aquifer cases are very well suited to the activities that I showed that can be used in clerkship level and also 4th-year students. So do pay attention to what the appropriate level setting should be for the activity. And I'll close it here, and Jake and I are both more than happy to take questions via email later on, but if you want to make a note of these email addresses, or we can provide you all with the slides, please feel free to reach out to us anytime. We did want to have plenty of time to take questions, though, right here and now. And so I'm going to go ahead and stop sharing my screen, and we'll see what we have in the chat. Okay, great. So we're getting a lot of questions coming in. From Ricardo Gonzalez, how do you do that exercise in a virtual group? I think that one was directed towards Jake. Jake, do you want to comment on how you use that exercise in a virtual group?
Yeah, sure. Just to preface, our campus has some advantages. I live on a regional campus, and so our students already do much of their education virtually. We have lectures that go back and forth between 3 campuses, and our students for their clerkship sites are spread out over, a few hundred miles. And so even weekly didactics have been done remotely. So our students are really comfortable with technology, communication, and all have laptops that allow this type of communication. Essentially, it works the same way. We use a program called Blue Jeans. It's much like Zoom, but it allows us to put students into virtual breakout groups. So just like the meeting we're hosting here, we'll have a setup or an introductory lecture. We'll break the students into small group. As an instructor, I have the ability to go from small group to small group to small group. So I can sort of pop in and observe and provide feedback for individual working groups throughout the session. And then typically we'll bring the whole group back together at the end just for wrap up and next steps. But it works essentially the same in a virtual format as it would live, at least for us, excepting that our students may have, and our campus may have some technological advantages that not every site will have.
Yeah, great. And we had one question come about sharing slides and sharing this content. And as Jacob put up on the chat, the rubric and these slides are available on the MedEd portal. And the slides, actually, Jake's rubric will be on the MedEd portal and our slides will be made available to you all. Gabriel Neal asks, we used Aquifer cases as the basis for students to write SOAP notes when they could not be in the clinic. And that was fairly well received by students and faculty. So a comment here from Gabriel Neal. And yes, absolutely. We similarly, in our alternative distance learning clerkship for pediatrics, have students write a history and physical, which seems fairly basic. Given the modular approach of these cases, and had the preceptor grade the history and physicals, and we had some students commenting that it was the first time they really had someone carefully look at their H&P, and they were very appreciative of it. So it allowed us a chance to kind of take a step back and develop clinical skills that can even get rusty over a few months. Okay, Beatrice Tapia, I apologize if I mispronounced your name, asks, can you talk more about the logistic of scheduling students? Meaning, how do you organize this in the middle of clinic and in the middle of clerkship, excuse me. So for us, the practical answer to that question was when COVID basically smashed our clerkship. We developed this activity of a virtual distance learning clerkship on the fly, and Aquifer really gives you great tools to be able to do that quickly. And the way we organized it was to take our entire cohort of students, which are spread out across Washington State, and put them into small groups. And we had to recruit several pediatric preceptors to do that. And that was a fairly big ask. So if you're a clerkship director or a course director, you really want to leverage the resources that you have and the great preceptors that you have. In Jake's use in Medical College of Wisconsin, using students to provide feedback to other students is also a great way to organize this. But we organized it with small groups and found that that was a really great interactive learning environment. Jake, do you have anything you would add to that?
We use a longitudinally integrated clerkship. We started out with half-day-a-week didactics and found it too disruptive for the preceptors. So we've since switched to having weeks where we pull all of our students back on campus. They have a combination of didactic skill sessions and evaluation assessment, exams and OSCEs. With COVID, even that's gone virtual. So we did a virtual OSCE. We actually had actors in New York City, people at multiple campuses and students at their home, pulling all of this together. It's doable. It takes a lot of work, a good coordinator. And my general advice in doing things virtually, as we experienced earlier, is tech problems happen. And make sure that you have a person whose sole responsibility is monitoring the main room and shuffling people in and out of breakouts. So we always have one of our education coordinators to help in that role. For prescription writing, we do an IPE activity with our pharmacy students. So medical and pharmacy students come together around a case, and then we'll often throw out a what if challenge. You know, what if they were allergic to this? Then what might you do? And have them write the prescription. Or what if the causative organism was this instead of that? What might be different? And have them write. And we do that asynchronously using discussion boards.
Yeah, and we're getting some excellent comments coming in from Chrisia Nulis. Apologies if I mispronounced your name. States, we found that not all specifics or details were present in every student oral presentation, which actually helped students to leave out the irrelevant info that they tend to dwell on. So they're seeing and hearing presentations from their peers. And we found that too, Chrisia. Our students really valued being able to hear what their peers were presenting orally. And in our prescription writing activity, we just used Aquifer cases as a very basic platform and generated an activity that took a hypothetical situation for their Aquifer patient and used it to have them write a pediatric prescription for an antibiotic, for example, which was really important in pediatric care to introduce students to the principle of pediatric prescription writing, you know, for different ages and sizes of patients. Let's see, Allison McComb asks, how would OSCEs work virtually with actors or standardized patients when it comes to physical exam skills? The history part is doable virtually via a virtual interview. That's a great question, Allison. Jake, do you want to comment on that? Oh, it looks like Jake already has. Excellent.
Chris, I can take it. So yeah, I mean, this came up obviously right. Our OSCE was scheduled to be about 3 weeks after everything ended. So we had to pull this together really quickly. For this past year, we just gave the SPs scripts and they read them. If this continues, we actually have the ability to broadcast sounds and exam findings using simulated equipment. And so when the student says, I'm going to listen to the lungs, if this happens next year, we'll actually play recorded lung sounds. But this past year, we just said, you know, you hear crackles at the right base, and went from there. So it did not allow us to assess their physical exam skills in the same way that we would in a live session. For the most part, that was okay because our OSCE was formed around handoffs, informed consent, clinical decision-making, and things that by and large, we moved past the assessment of the physical exam skill, and the OSCE was designed to assess other aspects of student competencies.
Thank you so much, Jake. And from Deborah Lehman, she states that this is what we did at UCLA. The student asks for the physical exam findings, but has to ask specifically what they are interested in. It's not optimal and use the OSCE for interviewing in the H&P write-up. And it also brings up a point about using Aquifer modules in physical examination. It looks like we're going to get kicked out here in a second, but we kind of had students stop at intervals through their Aquifer module to help facilitate that kind of learning without, pushing them too far forward in the case. And I think the Aquifer cases are pretty good about unfolding in that way. But yeah, physical examination skills are tricky. And we'll see if we have any other questions coming through. We just have another half minute. Claudia Daly mentions the AAFP SAM clinic exam we used to do. Jake may be familiar with that.
Yeah, we've not found terribly effective sims yet to replicate it. We're working on it, but nothing really mirrors the live interaction like what we're having now. So I think we've got 5 seconds. I just want to thank everyone, and please email Dr. Anderson or I, Chris or I,